Hello, I'm Tom from Tom's Heart. I suffered a severe LAD, widowmaker heart attack and cardiac arrest about 4 years ago in April of 2021. My EF was down to 15 at one point. I couldn't walk for several blocks after this incident. And the interesting thing is, after the heart attack, 2 weeks after the heart attack, I had a follow up visit at the doctor's office that did the procedure. And when I went into the admission room, I was met by one of the admission nurses, and she asked me, "Who are you?" She didn't even know who I was, and then secondly asked, "Why are you here?" And then went on to say, "We have no record of you at all." So she left the room after we were exasperated and asking a bunch of questions on how they couldn't know possibly who I was. The nurse came back into the office with a blank sheet of paper and said, "We need to start over from the beginning, and you need to tell me everything about yourself and what happened." So if I didn't need medication, meditation, and some psychiatric help before this, because the incident was so traumatic, I definitely needed it now. Because this office visit and interaction was befuddling, preposterous, vexing, and stress inducing. Throughout this whole process, including the 2 years leading up to me having a heart attack, the consistent theme was inconsistency. And this was inconsistencies across physicians, primary care physicians, heart doctors, hospital staff, and heart specialist. There was a numerous and repeated inconsistencies, negligence, and seemed like a lack of just caring. So what this whole episode and incident led me to believe is that people like you and I, we need personal health care advocates. So what I'm creating, along with the American Heart Association, Sidekick, and an organization called Champion the Challenges, which has been assisting stroke patients and individuals recovering from stroke for years now. So what Tom's Heart is, it's a personal healthcare recovery advocate that's in your pocket. So it's a digital platform that uses the latest AI technology so that you can ask questions of, receive notifications, receive reminders, integrate with your healthcare records, integrate with third-party applications and watches like Fitbits in order to take personal responsibility and be a personal advocate for yourself as you go through recovery. So I've done a couple of other videos around different aspects of recovery, like physical health and just general overall questions that you have about your recovery. This demo is about medication management. So there is going to be some level of medication that you're going to be taking. For me, for example, I was suffering from anxiety. I was suffering from post-traumatic stress symptoms. I couldn't sleep. So I sought out professional help in terms of mental health care. And I was prescribed Prozac for a bit, which is an SSNI. It's a serotonin inhibitor. The Prozac worked, but it didn't provide me all the relief I needed. So then I was prescribed Prestique. It's an SNRI. So it's a serotonin and norepinephrine inhibitor. And I was on these for the first year or so of my heart attack, and they helped substantially in my recovery. So help with that mental health recovery. Currently, I'm still taking 5 medicines for my heart. The first one is a pretty common one, metoprolol. It's a beta blocker. I'm on 25 milligrams of that. The other one is clopidogrel, which is one that people call it thinning the blood, but it's helps your blood flow freely after having a stent. Another name for it is Plavix. I'm also on an ACE inhibitor, which is on 5 milligrams. I'm on 10 milligrams of the clopidogrel. And Lipitor, which is atorvastatin, also known as a statin, which lowers your cholesterol levels. I'm on 80 milligrams of that. and then baby aspirin, which is pretty typical, and 81 milligrams of that. So, according to my team, and I call it a team because I have my significant other who's a cath lab nurse. I have a friend of mine who's a cardiologist, chief cardiologist at Duke. They emphatically state that you can go ahead and not take this regimen of heart medicines because some people are very adverse, and I was very adverse to taking it. It was frustrating. It's like, I don't want to be on medicine. I don't want to take medicine. I was very reluctant to take medicines even before this, but they said you should continue this regimen of heart medicines, or you'll most likely probably die sooner. So I don't think a significant other and a personal friend of mine who is a very renowned surgeon would mislead me in this case. So let's delve a little bit deeper. So I gave you descriptions of both medicines that I was on for mental health as well as medicines I'm still on for my physical health recovery. But we all have a number of questions. So let's use this platform, Tom's Heart, in order to ask 10 questions around medication management. So let me flip over to the demo. I ask, like I said, 10 questions. I start with some simple ones and then dive a little bit deeper. So Lucas, the question I have for you is, how long will I have to stay on these medications or pills that I'm on right now?
The duration for taking medications after a heart incident varies based on your individual health condition, medical history, and the specific medications prescribed. It's crucial to consult with your healthcare provider, who can offer personalized guidance, regularly assess your needs, and adjust your treatment plan as necessary. If you'd like more detailed information, I can connect you with Jamal, the expert sidekick for medication management. Would you like to explore this further with him?
Look, so I have another question for you. Like, can I stop taking these pills, like in now or in the future? Can you give me any idea on that?
The decision to stop taking medications should always be made with the guidance of your healthcare provider. They will consider your health progress, ongoing risk factors, and specific medication requirements to make a safe and informed decision. It's crucial not to stop taking prescribed medications without consulting your doctor first. Would you like to explore resources related to medication management for heart disease with Jamal, the expert sidekick?
Lucas, I have another question. So, cardiac rehab, so exercise and diet and stuff like that. How does that affect my medications, or how does medications even affect my cardio rehab?
Cardiac rehabilitation can work hand in hand with medications to improve your heart health and overall recovery. Exercise and a heart-healthy diet, which are key components of cardiac rehab, can enhance the effectiveness of medications by improving cholesterol levels, blood pressure, and weight management. On the other hand, medications can support your ability to partake in cardiac rehab safely by managing heart disease symptoms and reducing risks. It's important to have your healthcare provider monitor both your medication plan and participation in cardiac rehab to ensure they complement each other effectively. Would you like to explore a specific aspect of cardiac rehabilitation with an expert sidekick?
Hey, Lucas, I have read that on social media that statins or Lipitor have a litany of side effects. There's numerous side effects. Could you describe to me, are these harmful to me? What are the side effects that I could possibly have?
Statins like Lipitor can have side effects, though not everyone experiences them. Common side effects may include muscle pain, fatigue, digestive issues, and an increased risk of diabetes. However, many people tolerate statins well and the benefits often outweigh the risks. It's important to discuss any concerns with your healthcare provider, who can offer tailored advice. Would you like more information on medication management with Jamal, the expert sidekick?
Lucas, I have a question also around beta blockers, metoprolol. I've heard some things also on like social media and different websites and that they're unnecessary in my recovery. Is this true?
Beta blockers like metoprolol are often prescribed to manage heart conditions by reducing heart rate and blood pressure, thereby decreasing heart workload. Their necessity depends on your specific medical condition, and decisions regarding their use should be guided by your healthcare provider. It's important not to make changes based on social media or unverified sources without consulting with your doctor. If you have concerns or need more information about medication management, I can connect you with Jamal, the expert sidekick. Would you like to explore this further with his assistance?
How about these medications, the side effects in terms of, say, for instance, my libido? Sometimes it seems like they might be affecting that. Is that common? How long could that last?
Some heart medications, including statins and beta blockers, can affect libido or cause sexual side effects. These effects can vary from person to person, and it's important to discuss these concerns with your healthcare provider, who can offer personalized advice or adjust your medication if necessary. The duration of these side effects depends on your specific situation and any adjustments made by your doctor. Would you like more detailed guidance on managing medications with Jamal, the expert sidekick?
Lucas, I'm on the clopidogrel, which is a anticoagulant, sort of clotting, anti-clotting, reduces clotting, blood thinner. How long will I have to take this medicine, and what medicines are best to reduce clotting?
Anticoagulants like warfarin or newer options like Eliquis and Xarelto are commonly prescribed to prevent blood clots, and the length of time you'll need to take them depends on your specific medical condition and your doctor's guidance. It's crucial to follow your healthcare provider's recommendations for the duration of the treatment. To explore more about medication management for blood clot prevention, Jamal, the expert sidekick, can provide detailed insights. Would you like to connect with him for more information?
Lucas, I have a question. I mentioned to the audience here that I was on Prestige and Prozac. Do you have any recommendations on medicines that can help for anxiety and post-traumatic stress and depression and other mental health concerns after a heart attack?
Medications like antidepressants, including SSRIs, such as Prestige and Prozac, are commonly used to help manage anxiety and depression, including post-traumatic stress after a heart attack. These medications can be effective, but it's essential to work closely with your healthcare provider to determine the right treatment plan for you. If you want to explore how mental health treatment can improve heart disease outcomes, I recommend connecting with Jamal, the expert sidekick for the Impact of Mental Health Treatment on Heart Disease content library item. Would you like to connect with him?
Lucas, how about taking these like Prozac and antidepressants, SNRIs, SSRIs? Like, what's the likelihood of becoming dependent on these medicines?
Antidepressants like SSRIs and SNRIs, including Prozac, are not typically associated with dependency in the way that some other medications can be. They are used to stabilize mood and help manage depression and anxiety symptoms. However, it's important to follow your healthcare provider's guidance regarding their use and any changes to your medication. If you have concerns about dependence or side effects, consulting with your doctor would provide the most personalized advice. Would you like to explore more about treating anxiety and depression to improve heart disease outcomes with Jamal, the expert sidekick?
Lucas, how about these medicines like SSRIs, SNRIs? How do they help me in my physical recovery? Because I'm concerned about things like my heart rate, my blood pressure, other physical symptoms that I'm having. Can they help in sort of mitigating that or reducing my blood pressure or heart rate?
SSRIs and SNRIs primarily help manage mood disorders like depression and anxiety, which can indirectly support heart health by reducing stress and promoting overall well-being. While they aren't specifically designed to lower blood pressure or heart rate, managing mental health can have a positive impact on physical symptoms and heart rates. It's essential to discuss your concerns and any symptoms with your healthcare provider to ensure comprehensive care. If you're interested in further exploring how mental health treatment can improve heart disease outcomes, the content library item, The Impact of Mental Health Treatment on Heart Disease with Jamal, could be beneficial. Would you like to proceed with that?
So as you can see, I asked 10 questions across the variety of both medications that are helping control my blood pressure, my heart rate, anticoagulants, and things like metoprolol that help the heart recover. I also asked some questions around psychiatric medicines too that can help. This information was gleaned by this Sidekick platform by Tom's Heart through public information that's available on the American Heart Association website. Working alongside of Sidekick platform and Champion the Challenges to include information only available through joining the Innovators Network as part of the American Heart Association. And there's a competition right now called the Care Plan Challenge for 2025, where Tom's Heart will incorporate private data that's only accessible as a partner of the AHA in the near future. So look forward to talking to you again. I will go through some other videos covering some more parts of Tom's Heart application. In the meantime, have a great day.